Ever wondered what PCOS is and how it develops? Today you're about to find out. PCOS, short for polycystic ovary syndrome, is a hormonal disorder common among women of reproductive age. Women with PCOS may experience prolonged or infrequent menstrual periods and have higher than normal levels of male hormones. This can lead to the development of numerous small collections of fluid or follicles in the ovaries and failure to regularly release eggs. It's not just a health concern affecting the ovaries, but a complex condition that can have implications on a woman's overall health, contributing to long-term problems like heart disease and diabetes. For medical students, understanding PCOS is crucial, as it is a common condition that they will inevitably encounter in their careers. So, ready to dive deep into the world of PCOS? Let's get started. Scene script. Imagine a perfectly functioning female reproductive system. Now, let's introduce PCOS into the picture. Polycystic ovary syndrome, or PCOS, is like an uninvited guest that starts to change the very environment it enters. It all begins with a subtle yet profound shift in the hormonal balance of the body. The female body, which usually maintains a delicate harmony of hormones, suddenly finds itself producing an excess of androgens, the so-called male hormones. This isn't just a minor hiccup, it's more like an orchestra conductor suddenly deciding to let the percussion section drown out the rest of the instruments. The result? A cacophony that throws off the entire performance. Similarly, this excess of androgens disrupts the normal functioning of the female reproductive system. One of the first places this imbalance makes its mark is in the menstrual cycle. The regular rhythm of the menstrual cycle, orchestrated by the ebb and flow of hormones, starts to stutter and falter. The periods may become irregular, or they might even stop altogether. It's like a clock that's suddenly lost its ability to keep time. But the effects of PCOS aren't limited to the menstrual cycle. The hormonal imbalance also interferes with ovulation, the process by which an egg is released from the ovaries. In a normal cycle, one or more eggs are released every month. But with PCOS, this process goes awry. Instead of being released, the eggs might remain in the ovaries, leading to the formation of small, fluid-filled sacs known as cysts. Just imagine a garden where the flowers refuse to bloom. That's what happens to the ovaries in the early stages of PCOS. The eggs, like buds that never open, stay trapped inside the ovaries. And just like that, we've set the stage for PCOS. But what happens next? Tune into the next part of our series to understand how this condition progresses and the impact it can have on a woman's health and well-being. Until then, remember, knowledge is power, and understanding PCOS is the first step towards managing it. Now that we've seen the onset of PCOS, it's time to understand its progression. Polycystic ovary syndrome, or PCOS, is a complex condition that doesn't just appear overnight. Instead, it's more like a snowball rolling downhill, gathering size and speed. It begins subtly with slight hormonal imbalances, and over time, these imbalances can lead to a cascade of health issues. The primary players in this hormonal tug-of-war are insulin and androgens. Insulin resistance, a common feature of PCOS, triggers the body to produce more insulin to compensate. This excess insulin then stimulates the ovaries to produce more androgens, such as testosterone. It's this overproduction of androgens that's the key driver in the progression of PCOS. Androgens are like the naughty kids on the block, causing all sorts of mischief in the body. One of their favorite haunts is the ovaries, where they interfere with the normal development of follicles. Instead of maturing and releasing an egg as they should, these follicles get stuck in a sort of adolescence, forming small cysts. Over time, these cysts accumulate, giving the ovaries their characteristic polycystic appearance. But the effects of PCOS aren't confined to the ovaries. The hormonal imbalances can also lead to a host of metabolic issues, such as weight gain, type 2 diabetes, and cardiovascular disease. And let's not forget about the impact on fertility, those immature follicles I mentioned earlier. They're also the source of the eggs needed for conception. With PCOS, the process of ovulation can be irregular or even absent, making it difficult to conceive. PCOS is a bit like an iceberg, with the most visible symptoms often masking a deeper, more systemic issue. It's not just about irregular periods or acne, although these can be distressing in their own right. It's about an intricate interplay of hormones that can affect a woman's health in myriad ways, from her reproductive system to her metabolic health. It's clear that PCOS is more than just a reproductive issue, but what are the key points to remember about this condition? Scene script. PCOS is a complex condition, but there are a few key points that you should always keep in mind. Firstly, PCOS or polycystic ovary syndrome is primarily a hormonal disorder. It's marked by an overproduction of androgens or male hormones in the female body. This hormonal imbalance can trigger a series of physical changes and symptoms, such as irregular periods, excessive hair growth, and even infertility. Secondly, let's talk about progression. PCOS typically begins in the reproductive years, often around the onset of the first menstrual cycle. However, it's not unusual for symptoms to become more apparent later in life, especially following significant weight gain or other changes in lifestyle. It's also important to note that PCOS is a chronic condition. It doesn't just go away on its own, and left unchecked, it can lead to serious health complications over time. Speaking of complications, PCOS is not just about the ovaries. This condition can increase the risk of developing other health issues such as type 2 diabetes, heart disease, and endometrial cancer. It's also associated with mental health concerns like anxiety and depression, which further underscores the importance of comprehensive care and management. Now, let's touch on early detection and treatment. Despite being one of the most common hormonal disorders in women of reproductive age, PCOS often goes undiagnosed. This is largely due to its wide range of symptoms, which can vary significantly from person to person. But here's the thing, the earlier the diagnosis, the better the prognosis. Early detection and treatment can help manage the symptoms, prevent complications, and improve quality of life. Finally, it's worth emphasizing that while there is currently no cure for PCOS, it is manageable. Lifestyle modifications, combined with appropriate medical treatment, can go a long way in controlling the symptoms and reducing the risk of complications. So, there you have it, the key points about PCOS, but how can this knowledge be applied in the real world? So we've learned a lot about PCOS, but what does this mean for you, whether you're a medical student or just someone wanting to learn more about this condition? Unpacking the complexity of PCOS, we understand how it's not just a menstrual or fertility issue, but a systemic health condition. It's about insulin resistance, hormonal imbalances, and chronic inflammation. And these elements don't just affect the ovaries or the reproductive system, but the entire body. This understanding is crucial, as it aids in the early diagnosis and effective treatment of PCOS. It's not about treating individual symptoms, but managing the condition as a whole. As future medical professionals or health enthusiasts, this is the approach we need to adopt. We've seen how PCOS can lead to serious health conditions like diabetes, cardiovascular diseases, and even endometrial cancer. Early diagnosis can prevent these complications and improve the quality of life for those living with PCOS. And this is where our understanding of the condition comes into play. Research in this field is of paramount importance. It's through research that we've come to understand the multifaceted nature of PCOS. And it's through research that we can discover better treatment options. Remember, PCOS is not a life sentence, it's a manageable condition. And the first step towards management is understanding. It's about understanding the condition, its implications, and the ways to manage it. It's about empowering individuals with PCOS and those around them with knowledge. It's about creating awareness, busting myths, and eliminating the stigma associated with PCOS. And it's about ensuring that those with PCOS receive the care, support, and treatment they deserve. So let's continue to learn, to research, and to understand. Let's continue to strive for better diagnostic methods, treatment options, and ultimately a cure. Whether you're studying medicine or just interested in health, understanding PCOS is crucial. It's a complex condition, but with knowledge and research, it can be managed. Remember, knowledge is power.